Hello, am I audible? Good afternoon. How's everyone doing? Okay, that's perfect. And how are you feeling about your exam preparation? I'm good. Thank you so much. I'm good, Dr. Safia. Okay, I was expecting this answer like you are feeling nervous and you are facing some anxiety. And honestly, this is absolutely normal and it is natural to feel that way, even if you're writing any type of exam. So don't worry for now. Just trust yourself and trust your hard work. And honestly, if I ask you this question a day before exam, your answers would be similar.
Napakilagtis ka.
Okay, so before we start today's session, could everyone please mute their microphones so we can avoid background noise? So welcome to today's MRCOG-1 teaching session. I'm Dr. Simbali Jas, your mentor for this session. In today's session, we will cover three key areas. The first one is how to book your MRCOG Part 1 exam properly. Then there would be a core teaching session on gestational trophoblastic disease, including partial or complete molar pregnancy and choriocarcinoma. Then I will discuss some tips and tricks for the effective study and time utilization since you have very limited time left for your exam. So it should be important that you know how to utilize this crucial time for your exam preparation. Exam booking, this needs to be done correctly because many candidates underestimate how quickly the centers fill up, and there are some common mistakes, including forgetting to reset the password, waiting too long and losing their preferred center, or even entering the wrong details during checkout. So be mindful about these points that you should avoid these pitfalls. But don't worry, today I will guide you each and every step how you can book your part 1 exam effectively. So here on the screen, you can see the exam calendar for January 2026 exam. And here the booking window application opens on Tuesday, 21st of October 2025. So this is the date, and you just have 2 days left for your exam booking. And in these 2 days, you need to make sure you have enough amount, your exam fee in your bank account and your bank card, whatever bank you are using for your exam payment, that should be eligible for international transaction, and the limit should be up to the mark. For in terms of your exam fee, you need to check your bands, in which country your band, in which band your country lies, and according to that, your fee would be decided. For instance, for the candidates who are writing the exam in India, Pakistan, or Bangladesh, they lies in band B, and for the band B, the fee is £572. But here's an important update on Part 1 and for Part 2 exam fees for candidate in India. There is an exception this year for the candidates who are sitting the exam in India, that their fee is increased. Okay, I have checked the website like 2 weeks ago, and 2 weeks back it was showing the £572. Okay, I will check that again. Okay, please backend team, make sure for year January 2026, the fee is still £572 or it is updated to £601. Okay, another important update. Okay, thank you so much for correcting me. So for band B, it is £601. And another important update for the students who are in the India, they have some additional tax to their fee, which is £103 to their standard fee. For instance, if it is updated to £601, they need to pay extra £103 if they are writing the exam in India. Let me give you a summary on MRCOG-1 booking steps. There are a few steps you need to follow. What would happen? I think all of you must have received that email by the RCOG by now. In that email, they will provide you a link for your exam candidate exam portal. What you need to do, you just, when there's a time for the exam booking, the portal would be open. You just need to click on that link, and that would show another bar which shows enter the password. I will show you the slides one by one, how you can follow each and every step. For now, just have an idea, like you need to click on the exam portal, you need to reset your password, then log in again on your candidate exam portal. And once you log in into your portal, you will see the dashboard, and the bar for the exam booking will be in front of you. And finally, once you need to select your center and you need to pay the fee and check out. And once you did this step, the very last step, the checkout one, you will automatically receive an email by the RCOG that you have successfully booked the exam. So eligible candidates have been sent an email confirming the booking window opening. The email includes a link to the RCOG candidate exam portal. Follow the link to the portal and create a password specifically for this platform. This password is solely for the accessing the exam portal and is not linked to your RCOG website login. And that is the very first mistake all the candidates do. What they usually do, they just click on this link and they start entering their username and the password which they used for making their RCOG website account. But if you do this step, you will literally waste your time. What would be your reflex at that very moment after clicking on this link? You need to click here, which is first time users. And once you click here, you will get an email to reset your password. Okay, after clicking on the click here to set password, you will taken to the next page. Input your email address and click on the reset password button. Ensure that the same email address that you have registered on the RCOG website, you need to use that email address. There is no chance that you change your email address. If you haven't received the email to reset your password, please check your spam folder as it may have been filtered there. So this is the password reset notification. You need to click here. And now when this bar appears on your screen, you need to enter your email address here and click on reset password. And here, now this is the final step in resetting your password. Your username, that would be same, that would remain the same. You need to enter the password of your choice and then reconfirm the password and set your password. And once you do that, you will log in into your exam portal. Make sure your password should be minimum of 6 characters long and include at least one punctuation character and one number. And these are the punctuation characters. And why we are sharing these details with you, because when the exam booking is open, everyone is booking exams. Sometimes the system slows down, and there are limited seats. There is a competition for exam booking. So if you do these little mistakes, literally they will waste your time. And when you are booking the exam, every seconds count. So please make sure, for instance, if you reach to this step and you are just trying different passwords and they are rejecting those passwords, so make sure even if you write the password of your choice before the exam booking on a paper. So make sure you need to add these things. Your password should be a minimum of 6 characters long and includes one punctuation letter out of these and one number. Is everyone following me? Okay, that's good. If you have any question, you can ask me anytime. Okay, I'm repeating my question. Is everyone clear up till now? Like how you can open your email, how to click on the link, and how to reset the password. Is everyone sure about they are fully familiar with this step of resetting the password? Okay, that's perfect. It means all of you are genius because it is quite complicated. Um, I remember when I was booking my exam, I did a lot of mistakes on this step only, and I wasted a lot of my time. It took me 4 hours, almost 4 to 5 hours to book my exam. But luckily, I was fortunate enough to book my exam. But please don't repeat these mistakes. Okay, once you reset your password and you are successfully logging into your student exam candidate exam portal, you will see this page on your screen, which have a welcome note in front of you. Okay, here what you need to do, you need to click on exam bookings. or you can book your exam with Pearson View Center. So these are the options you need to click. And once you click on the exam bookings, they will show you the pre-approved exams, and this part is would be shown only to those candidates whose eligibility has been approved and they have successfully submitted the expression of interest. So if you have successfully done these two steps, then only you will see this pre-approved exam on your portal. Okay, so the next step is you need to click here. Then if you have time, you can read these. Otherwise, you can just simply go and accept the terms and conditions. Okay, once you do that, on your screen, they will provide you some, they will suggest you some exam centers according to your location, which you have provided on your eligibility form. So they usually suggest more than 3 centers if they are there in your area, or the centers which are nearest to your area. So just have a look on the exam centers and see what exam center is suitable for you, but please do have some backup option. For instance, if you have the best, you want to write the exam in the exam center A, for instance, but please keep in your mind you should have a backup for B and C as well. Like if you are unfortunately, if you cannot manage to book the exam in exam center A, then please be ready for the center B as well. What you're gonna do after selecting a center, available dates and times should appear. If no appointments are shown, it indicates that your chosen test center is fully booked or unavailable. RCT does not have exclusive access to Pearson centers. Other exams may schedule simultaneously, limiting available slots. If your chosen center has no availability and you have selected only one center, use the previous button. So anytime if you don't find any appointment on your preferred exam center, you can simply click on previous button, and that will redirect you on the previous page, which shows the different exam centers. If you have selected multiple centers, you can easily switch between them to check availability. Click on the next to each center to view its availability. I will show you in the next slide how it looks like, how the appointments would be shown on your screen. If your chosen test center still has availability, click on the desired date, then select your preferred time slot. So this is how it looks like. For instance, these are the 3 exam centers, A, B, and C. And once you click here on the dot on the exam center A, it will show you a calendar and the available time slots. And according to your convenience, you need to select your time slot. It could be from 10 a.m. to maybe 4 p.m. It depends on the Pearson Center and the available slots. But whatever the time suits you the most, you can easily click that. And once you select your exam center first, then the date, and then the time, and once you proceed this page, you will get this payment page on your screen. And this is the final step. And here, please make sure your card is ready, that is eligible for the international transaction, and there are sufficient funds in your account. Then once you, and make sure you fill the details correctly so that you won't waste your time. And once you are done with your payment, you will automatically receive an email on your email address that your exam has been successfully booked. So this is all about how to book the exam. Is anyone have any question?
Ma'am, I want to ask you that once I was submitting my eligibility form, I was living in Multan, Pakistan. But then I moved to Rawalpindi and Islamabad. So how will I change my exam center? Because it was 2 years ago when I submitted my eligibility form and expression on interest. Now I have submitted it. So how will I change my center and addresses?
Okay. Okay, I understand your question. Okay, in your case, if you can see on the screen, here is a search bar. You can easily enter the location of choice here, and it will show you the recommended test centers in that particular area. Did you get this point?
Yes, ma'am.
Okay, so it's not a problem. You just simply need to search here. For instance, if you now write the exam in Islamabad, you can easily write here Islamabad. It will show you the exam centers for Islamabad here down below. Now, there are multiple slots available, but it all depends on the Pearson Center. I remember when I was booking my exam, there were three slots. Like there was exam conducting at 9 a.m., then on I think 12 p.m., and then at 3 p.m. So there are multiple time slots there for your exam booking. But again, it varies from center to center and the availability of the time slots. So let me summarize this step. Okay, I request everyone to turn off their mics so that there would be no background noises. Okay, let me summarize the exam booking step. There are some tips for you. Please be prepared. Do have all the necessary information and documents ready, including your ID and payment details. However, in terms of your exam booking, the payment details are way more important. Your card should be there. Set a reminder for the day and the time of the exam booking. Check your emails regularly. You might log in early because sometimes the website really crashes down when everyone is booking the exam and the system really goes down. Some do have some backup options like prepare any alternative choices in case your preferred slot is not available. Double check the details, stay calm. That is the most important thing. You might attend preparation sessions, join scheduled sessions for the helpful insights and tips for the exam booking. You might take time off work if that is the exam booking time is clashing with your working hours. You might take a time off. And I know in the hospitals the internet never works fine. Set clock to UK time. You can also do that. Ensure the high speed internet, and you may have a backup internet as well. Minimize the device usage, have a backup internet plan, and set the alarm for the exam booking day. Laptop is a preferred one because the internet runs smoothly on laptop as compared to the mobile phone. But you can do that with the mobile as well. There is no harm in that. But if I talk about the running of the system and the smoothness of the internet, then the laptop is the preferred option. So what are the don'ts? Make sure the candidates sort out any issue with their RCOG login or password before the booking day. Keep a note of what's fixed in your Word file. Don't use the same password for the exam portal. That means the password which you have used for making your RCG website, please do not use that password in your exam booking portal, which I did actually. If you forget your password, don't keep clicking like crazy. It won't magically remember it for you. And again, I did this thing because I was really panicked. I had no idea like how I can book my exam because I remembered that was the very first time they introduced this candidate exam portal, and nobody was really aware that how we are going to book the exam. So I made all of these mistakes, and literally I have wasted a lot of my time. Have a chat with your bank before booking if your account can't handle international transactions. Check your bank balance before booking to avoid any insufficient funds. Double check those bank details early and save a backup copy in your Word file. Don't panic or rush during the booking process. I know it is very difficult to control your nerves during that time. Honestly, I have been booking my exams for so many times, And still, to this day, whenever I try to book my exam, I feel nervous and I feel panic and I have that tachycardia all the time. So it is very difficult to control, to have a good control on your nerves, but at least we can try. Don't assume slot availability. Always have backups. And I'm repeating this again and again that you should have some backup in your mind because if you stick to your preferred slot, then ultimately, if you don't find any other slot in your area or the preferred center city, ultimately you will waste your 6 months. So it is better to travel a bit more rather than wasting your 6 months. So conclusion is following these steps ensures hassle-free booking. Stay updated with the RCOG emails and best of luck for your MRCG Part 1 exam booking. And those who just joined us and they have missed the part how to reset the password, they can later on have the video recording. They can follow that video. Okay, Nayab, let me convert 601 pounds into PKR. Okay, it roughly makes around 2 lakh 26,649 rupees. In terms of tax, I think you should at least have 20,000 extra into your account for the tax payment. If you are doing payment with your local card, then yes, definitely you have to pay the taxes, and that roughly makes 20 to 25,000 maybe, but I'm not sure because every year it increases. Sure. Backend team, could you please confirm the fee for the Indian candidates and including their new taxes update? Okay, is everyone clear up till now? Dr. Richard, don't worry. Once I'm done with the session, I will quickly recap everything. And if not, then you will get the sessions recording, and you can easily watch the previous part of this session easily. Okay, so this is a topic which is the high yield topic in your MRCOG-1 exam, which is gestational trophoblastic disease. And honestly, this they just kept on asking different questions from the same topic, and it is not very difficult to be honest. If you only once if you understand the difference between the different types of gestational trophoblastic diseases, you can ultimately remember it for a very long time. So, what are gestational trophoblastic diseases? Uh, Gestational means something has to do with the pregnancy. Trophoblastic means something which which is originated from the trophoblast cells of the placenta. That means it is the classical condition which happens during pregnancy from the developing placenta, classically from the trophoblastic cells. So, in other words, it is the pathology of the placenta. So it is just an overview. It could be benign. Gestational trophoblastic disease could be benign, could be malignant. What are benign? That means they are less aggressive, they don't metastasize, and they are curable. The example is hydrated form moles. Hydrated form moles further are classified into two types. It could be complete mole or partial mole. Later on, these complete or partial mole, they tend to become invasive moles as well. And once this molar pregnancy become invasive, it is categorized under metabolic gestational trophoblastic disease. So we have a malignant category, which is invasive moles and choriocarcinoma. However, we have different variants as well for gestational trophoblastic disease. But for your part one MRCOG-1 exam, they just ask about, mostly they like to ask questions from complete molar pregnancy, partial molar pregnancy, and choriocarcinoma. Even they, I haven't witnessed any question from invasive moles as well. Okay, in order to understand in a better way, let's have a look. It is a single structure of placenta. Here, the outermost layer, you can see these are the projection, finger-like projections. And these finger-like projections on the placenta, they are known as chorionic villi. What is chorionic villi? This is the functional unit responsible for maternal fetal exchange. That means these are the villi, and this is the area which is responsible for the maternal fetal exchange. Below that, in this pink color, you can see it is the trophoblastic layer. It is further divided into cytotrophoblast, which is inner proliferative layer, and the syncytiotropoblast, which is outer layer creating HCG and aiding in implantation. And classically, these gestational trophoblastic diseases are the pathology which happens here in the trophoblastic layer, which includes cytotrophoblast and syncytiotrophoblast. Okay, let's talk a bit about molar pregnancy. We have two types of molar pregnancy. One is complete mole and other one is partial mole. What happens sometimes when when a single sperm, which is a haploid sperm, and or maybe the two haploid sperms, when they fuse with an empty egg, that means this egg has no genetic makeup. It is an empty egg. When this sperm fertilized with an empty egg which has no genetic material, what happens? This sperm then when enters into this empty egg, replicates its genetic makeup, converts into 46XX. Uh, but in this complete molar pregnancy, what happens? What is the result would be? This egg or fertilized egg only have male genetic makeup. It has no female genetic makeup in this fertilized ovum. So this is known as complete molar pregnancy. Later on, we will see what are the other differences. For now, just have an idea what is the karyotype of complete molar and partial molar pregnancy. On the other hand, what is partial molar? In this case, maybe two haploid sperms or a single diploid sperm fertilized with the normal egg, which has 23X chromosome number, and ultimately the number of chromosomes would be increased in this pregnancy. So 46 plus 23 give us 69 XXY. There could be different variants. It could be XXY, it could be XYY, or it could be triple X. So there are different variants depending on the type of sperm which fertilize the ovum. So this is partial mole. So again, the karyotype. In your exam, there are many questions I have seen in which they just simply ask you about the karyotype of complete molar pregnancy and karyotype of partial molar pregnancy. So in one word, whenever you see the karyotype 46XX, that means it is complete molar. And when you see the karyotype 69XXY or whatsoever, that is your partial molar pregnancy.
Ma'am, in complete molar pregnancy, you said that
Yes.
either 46X, 23XX, or single 23X will join the empty egg. So how would it make it 46XX?
Okay, that's a nice question. What happens when a single sperm fertilizes with an empty egg? This sperm then replicates its genetic material and becomes 46XX. Whereas when two sperms of haploid 23X or 23X or 23Y, when they fertilize this empty egg, they won't replicate their genetic material. So ultimately, the end result would be 46XX. Are you clear?
ma'am. Thank you.
Okay, so these are again the definitions. Complete molar, it is the abnormal diploid conceptus with the absence of fetus, typically 46XX. Now, this is the differentiating point. In your exam scenario, I will teach you according to the exam questions so that you don't waste your time on unnecessary information. You just need to remember the keywords here. Like in your clinical scenario, if they give a scenario in which a female presented with hyperemesis gravidarum, and when you did the scan, what are the findings and what are the karyotypic findings, you should have a crystal clear understanding when to pick complete molar and when to pick partial molar. So the one difference, that in complete molar we have 46 double X chromosome, and in partial molar we have 69 number of chromosomes. The other difference is that in complete molar pregnancy, there would be no fetus. But in partial molar pregnancy, there would be a fetal tissue, and that is a very important differentiating point, even if you forget about the karyotype. But you know that in complete molar pregnancy, there would be no fetus. And in your clinical question, they have mentioning about some fetal tissue. That means your answer would be partial mole. Is everyone following me?
Yes, ma'am.
Yes. Hmm. Then we have a third important condition, which is known as choriocarcinoma. It is a malignant tumor of the trophoblast. What else we have in malignant category? We have invasive mole. What happens sometimes is complete molar pregnancy or partial molar pregnancy. They start invading myometrium, endometrium, and myometrium. Sometimes they perforate the uterus and leads to metastasis. That's why we call, and these are and the invasive moles are very aggressive. So those invasive molar pregnancy, it also comes under the category of malignant gestational trophoblastic disease. For now, the important one is choriocarcinoma. What are the statistics? It is common. It is 1 in 1,000 pregnancies per year are molar. 1 in 45,000 pregnancies affected by choriocarcinoma. 70% of choriocarcinoma occurs after molar pregnancy. 20% after termination of pregnancy, and 10% after normal pregnancy. This point is very important to understand. They are saying in this last line, they are saying so many things. One thing, they are saying that the risk factor for having choriocarcinoma, the most important risk factor is molar pregnancy. And does anyone have any idea which of the molar pregnancy puts a high risk for having choriocarcinoma in future? Is it complete molar or partial molar? Out of these two molar pregnancies, which one of the following has the highest risk for choriocarcinoma? Okay, so the answer is complete molar pregnancy. If a female who have complete molar pregnancy in the past, she is at the higher risk of having choriocarcinoma in the future. What else happens? Sometimes, if a patient undergoes termination of pregnancy in the past, she is also at the risk of having choriocarcinoma in the future. And sometimes, 10% they have said, even if a patient have a history of pregnancy, she just delivered a normal baby, she might be at risk of having choriocarcinoma in the future. Hmm. Okay, there are some other risk factors. Why I'm telling you, because not just for your exam, for your clinical purpose, what things you need to consider in the history, or if you are reading your question statement, what are the other points you need to consider in order to reach to your diagnosis? So what else are the risk factors for the molar pregnancy? Now I'm talking about the molar pregnancy risk factor. Age extremes of reproductive life, like if a female get pregnant after 40 years of age, or if she got pregnant less than 15 years of age. So you see, these are the extreme of ages. If a female got pregnant in these extreme years of her life, there would be a risk of complete molar pregnancy. Then there is some ethnicity risk factors that it is most common in East Asia, particularly in Korea and Japan. So the incidence in Korea and Japan for the molar pregnancy is highest as compared to the other Asian countries. Then if a patient have a previous history of molar pregnancy, they are 10% increased risk of developing future molar pregnancy. So this is about the statistics, risk factor, and the difference between complete molar and partial molar. I assume that all of you are clear about the basic difference between molar, partial molar, and choriocarcinoma till now. Now let's talk about clinically, like how you can, how would your patient would present, and how would you diagnose your patient, how would you investigate your patient, and management is not important for the part 1 exam. It is you just need to know how you are going to diagnose your condition. That is the way more important for part 1 exam. So what would be the clinical features? They could be irregular first trimester vaginal bleeding. It is even more than 90% of the patients, they present with the irregular first trimester bleeding. Uterus large for dates. They could be theca lutein cyst resulting from ovarian hyperstimulation by high beta HCG levels. Because in molar pregnancy, one of the key indicator in terms of biochemistry is the excessive HCG production. So this is a biomarker for the diagnosis, monitoring, and follow-up of the molar pregnancy and choriocarcinoma. So remember, HCG is the key marker here. So why the patient have pain and why she developed theca lutein cyst? Because the ovaries are hyperstimulated by the effect of beta HCG levels. They could be exaggerated pregnancy symptoms like hyperemesis, hyperthyroidism, or maybe early preeclampsia. Anyone could answer me why the patient have hyperthyroid symptoms if she have molar pregnancy or partial molar pregnancy? Yes, that's the correct answer. Excellent. Yes, it is structurally similar to TSH. Basically, what happens, the HCG hormone, it has a thyrotropic effect. It has this natural tendency to stimulate the thyroid gland. Yes. So that's why, since the patient of molar or partial molar pregnancy, they have excessive amount of HCG, that might cause that might trigger hyperthyroidism in these patients. And sometimes the early symptoms could be of hyperthyroidism as well. For example, if your patient comes with irregular vaginal bleeding, she is having hyperemesis, she has large for gestational age uterus, and along with that, she is having tachycardia and she is having tremors as well. She is having increased sweating. So maybe there is a mixture of symptoms of molar pregnancy as well as hyperthyroidism. Dr. Zainab, there is no relative contraindication for any contraception in molar or complete molar or partial molar pregnancy. You just in this case you just simply need to follow that UKMAC criteria. If the patient is suitable for COCP, you can prescribe that. If your patient is suitable for POP, you can prescribe that. So there is no contraindication. Okay, so your biochemical feature is HCG production. So again, let me summarize this. These are the clinical features. You are suspecting at this, according to these symptoms, that your patient might have molar pregnancy. Then your next step would be you are going to investigate the patient. What is your investigation? What are the list of things you need to investigate? You need to order HCG level. You need to do um, thyroid function test as well. You need to do complete blood count. Yes, and the ultrasound. So these are your investigation of choices. Then your diagnosis would be confirmed on ultrasound assessment. And and this is a formal diagnosis, that means you are done with the ultrasound. Now the diagnosis is confirmed, the patient has molar pregnancy. Mostly the partial and the complete molar, we do curettage. And once we do curettage, we send that sample for the histopathological assessment following the evacuation. And then the formal diagnosis would be also confirmed. So this is how we take the patient of molar gestational trophoblastic disease. Now you have successfully treated by curettage, you have confirmed the diagnosis, you have confirmed the formal diagnosis by histopathological assessment. What you are going to do next? You cannot send that patient to as per routine patients. You need to arrange the follow-ups for this patient. What is the marker to assess the recovery of the patient? We need to do HCG levels again and again, and we will wait till the HCG levels come back to the normal level. And once the HCG levels are normal, it could take 4 to 6 weeks, or it might take 8 weeks. But once that came back to normal, we need to arrange extra 6 months follow-up for that patient. And once the 6 months has successfully passed and the HCG levels are normal, now there is no need for follow-up. And sometimes, in case of complete molar, as we know, it has an increased risk of choriocarcinoma, and the histopathological assessment is a bit fishy, and you decided to give a prophylactic chemotherapy to the patient so that she won't have, so that we can reduce the chances of choriocarcinoma in the future for her. What you're gonna do in that? What is the recommendation for this patient who have undergone chemotherapy? You need to advise her not to conceive for 1 year after completion of treatment. For instance, if she has completed her chemotherapy 6 months after her evacuation, then you advise her to take a break for conception for 1 year at least before she get pregnant again. Okay, is everyone clear about the clinical presentation, diagnosis, and follow-up and recommendations? Okay, I have a question regarding choriocarcinoma. One, we know the choriocarcinoma originates from the trophoblastic or syncytial trophoblast cells of the placenta. And the molar pregnancy is a risk factor. Is there any other source of choriocarcinoma? One, we know it happens after pregnancy or during pregnancy due to molar pregnancy. What else is the source of choriocarcinoma? Okay, I think nobody knows the answer. Okay, when we know choriocarcinoma, the other source for choriocarcinoma, the risk factor you may say, is the germ cell tumors of the ovary. The germ cell tumors have the tendency to cause choriocarcinoma in the female in future. Why it is important to know? Because we know the chemotherapy is the ultimate management for the choriocarcinoma. So the patient, you are offering the chemotherapy. For instance, you have choose the methotrexate to a patient who have a history of molar pregnancy, and that's why she is having choriocarcinoma. The prognosis would be wonderful. But the patient, if you are offering chemotherapy and she have the choriocarcinoma due to germ cell tumor, then the prognosis would be poor. The next thing which is very important for your exam is the understanding of the ultrasound features of gestational trophoblastic disease. Because what happens sometimes in your exam, they just simply give you a picture of ultrasound scan. They will provide you some history, some clinical picture of the patient, and you need to diagnose on the basis of that picture of the ultrasound. So that's why remembering the ultrasound feature is very important for your exam.
Ma'am, I
So
have a
what?
question.
Yes.
This is for my personal knowledge because you said that treatment is not that much important for MRCOG part 1. Ma'am,
Yes.
you said we cannot send the patient as such, and we will send histopathology, and if it is malignant then we will go with chemotherapy. But nowadays, ma'am, practitioners, I have noticed that they do use methotrexate, no matter whether it is malignant or not.
Okay, that's a good question again. If we talk about the evidence-based practice, even I was studying that yesterday. Uh, they are saying if there is no risk, if you have evacuated the molar pregnancy successfully, and the histopathology is not that significant, and the patient is not, there are no other risk factors for having choriocarcinoma in the future, you can simply skip the chemotherapy. We don't offer chemotherapy, prophylactic chemotherapy, to all the patients who have molar pregnancy. So these are the guidelines, but I don't know about if we are so much concerned about the patient and we're just offering chemotherapy to all the patients. However, it is according to the guidelines, it is not necessary to offer chemotherapy to all the patients who have molar pregnancy. Okay, so coming back to the ultrasound features, what would you see in a patient, the scan of a patient who have hydrated form mole, which is a complete molar pregnancy? You will see solid collection of echos with numerous small anechoic spaces, which is known as snowstorm or granular appearance. These are the anechoic areas. You can see these are the solid collections. These are the multiple anechoic spaces, which gives the uterus a snowstorm or granular appearance, which is also known as bunch of grapes sign. Which why this happens? Due to swelling of the trophoblastic villi. The normal interface between abnormal trophoblastic tissues and myometrium. No identifiable fetal tissue or gestational sac. So in your exam, they might give you any of these options. They might give you just this hint that they are solid collection of echos, they are anechoic spaces, or they may just simply give you, if the question is easy, they just simply give you on the scan, we found that there is a bunch of grape sign. That means it is a complete molar. Your diagnosis is a complete molar. Or maybe if they haven't give any of these points, they just simply say the sonologists don't identify any fetal tissue. That means again your answer would be molar pregnancy. And what if they haven't provided you any of these key points in your question? They just simply, however, that is rare, they just simply give you a picture, but it is easy to know. Please make sure you are familiarized with the ultrasound picture of the complete mole because that frequently comes in the exam. So this is how it looks like. You just simply, it is very easy to identify and to pick hydrated form mole on the ultrasound. So this is how it looks like. Then the next is the partial hydrated form mole. I haven't seen any picture in the recalls from partial molar pregnancy. However, you need to keep the key points in your mind. What would be the clinical, what would be the ultrasound features? They would be enlarged placenta with multiple diffuse anechoic lesions, which is slightly similar to complete molar pregnancy. But the difference is in this scan, you will see the fetus with severe structural abnormalities or growth restriction. There could be oligohydramnios or deformed gestational sac. So the classical difference in molar and partial molar on ultrasound is the presence or absence of fetal features. Incomplete, there is no point that they would provide you with some fetal content in the ultrasound features. But in partial mole, they would definitely give you a hint that the sonologist found some fetal part or fetal structural abnormalities, or they may give you the features of growth restriction of the fetus. So there would be a part of fetus in partial hydrated form mole. Then we have ultrasound features of choriocarcinoma. Okay, for molar and partial molar, we do pelvic scan, the ultrasound, but for choriocarcinoma, we do Doppler pelvic ultrasound because choriocarcinoma is well picked up under Doppler studies. What the Doppler scan of the choriocarcinoma shows, an infiltrative heterogeneous mass invading myometrium and beyond. Why invading myometrium? Because we know it is malignant. It has the tendency to metastasize. So that's why it is invading myometrium. Cystic areas from necrosis and hemorrhage may be present, and there would be increased vascularity due to invasion. Another important point for exam, I have seen a question in which they ask about the metastasis of choriocarcinoma. So here I have shared a slide of different tumors and their route of spread. Let me look at the choriocarcinoma. Choriocarcinoma, the route of spread is hematogenous. So this is a very high yield point you need to keep in your mind for your exam. That choriocarcinoma metastasis through hematogenous route. Okay, so we are done with all the high yield points for gestational trophoblastic disease. I think I have covered all the points from the recalls and also which are the information which is relevant for your exam. If anyone have any question from this topic, you may ask me. Otherwise, I move on to the question part. Okay, it seems like you don't have any questions, so we are moving towards next slide, which is tips and tricks to solve SPAs. This is classically for your exam. What usually, these are the common mistakes you usually do while solving the SBAs. The first thing is understand the question. Take your time because in part one exam, you have enough time to solve questions. There is no time management problems in this exam as per my experience and as per my observation. So you can take your time to understand the question. Don't rush in solving the questions. You have 1.8 minutes for each question, and that is a lot of time. So the last line of the question is very important. Why it is important? Because sometimes they just give you a distractor in the exam and the clinical scenario. The last line of the question is very important because that is something which they are expecting you to answer. For instance, if they give a long scenario and at the end they just ask you the arterial supply of that particular structure, and you wasted your time on diagnosing the condition, and even if in a more smarter way, what you can do, you just start the reading question by the last line. What is their question? And this is the trick we usually do when we are giving the USMLE step 1 and step 2 exam, because the questions are very, very, very long. So what is the trick for USMLE step 1 or 2? First of all, we see the last statement, what is the question, and then we start reading the scenario so that we know what to pick, what is the right information to highlight from that question. And the same thing can be implemented on this exam. Then the second thing is elimination method. This is very helpful if you are blank about the question, if you have no idea what is this question about and what I need to answer, or if you are confused between 3 to 4 options, then you can go with the elimination method. Just start eliminating the absolutely not relevant options, and at the end you might left with the 2 options, and sometimes you might left with the correct answer. So this is a very good trick. Third, don't rush, which I have already mentioned. The fourth thing is clinical reasoning. For instance, if you are not sure about the answer, then start recalling your clinical practice, your experiences, and use your clinical judgment and reasoning to solve the answer. The last thing is the practice, which is the ultimate key to pass any exam. The more you practice, the more you retain the information. So these are the final tips. Uh, Please try to consider these when you are even when you are practicing the SBAs till your exam, because now is the time you make your reflexes. So don't save these tips and tricks for the exam day. So here's your first question. You have 45 seconds to answer the question. Select the features which are given, because I wasn't speaking, that's why you was not hearing my voice. Okay, so the features which are given in this question, these are typical features of choriocarcinoma. And again, the risk factors for having choriocarcinoma, the most important one is the molar pregnancy. If a patient has history of complete molar, then she is at risk of having choriocarcinoma. Then the 20% cases occur after termination of pregnancy and 10% even after normal pregnancy. Here is your next question. Very well done. E is the right answer. And yes, chest X-ray is advisable, which is a common metastasis site. Yes, that's absolutely makes sense. Okay, I have a question. What is the route of spread of choriocarcinoma? Why this patient is having this cannonball appearance in her on her chest X-ray, and why she, and how she is having this metastasis? Yes, hematogenous. Yes, this is a cannonball appearance. Uh, Whenever there is a metastasis of lung carcinoma, tumor, any carcinoma which metastasizes to the lungs classically shows cannonball appearance. In this case, the source is choriocarcinoma, but in other tumors, for instance, if we take uh, maybe breast tumor or any kidney tumor or any tumor which metastasizes to the lungs always show classical cannonball appearance. So this is a question from the recalls. They have provided this X-ray with this scenario, and the answer was, okay. Sometimes it happens when we see such things which are not relevant, not classically relevant from our field, like for obs and gynae. When we see ECG and when we see chest X-ray or CT brain, we just got panicked that this is something we can't interpret. But whenever you see such things in your exam, don't worry, they usually provide some hints in your question. For instance, in this question statement, they already give a complete history, the past history of partial hydrated formol. Now you are clear about this has to do something with the malignant gestational trophoblastic disease, and the most common one is the choriocarcinoma. In the marker, the serum marker for gestational trophoblastic disease is beta HCG. Okay, so uh, these were the questions, and now now we are heading towards over the last part of our today's session, which is the tips and tricks, like how you can utilize this time, the last 2 months you have left for your exam, how you can utilize this time with maximum ability, and what are the key strategies to focus on. So how you can start your preparation? Since you have not plenty of time to go into very deep details of each and every topic, so what we advise to our students that please focus on the high yield topics for all the subjects, and don't waste your time on unnecessary things or unnecessary theory books. So the high yield point topics, I'm sure you must be familiar from those by now. Then you can simply follow the mini schedule to keep, which helps to keep you on track. You can join live sessions to clarify concepts for each subject. For instance, if you don't have time to read theory and you cannot soak that information by yourself, you can't clear your concept by yourself, then this would help to save your time a lot. Then you can practice daily SPAs with your friends or on the Telegram group with us. Then practice subject-wise exam like questions on the website. And please don't ignore these, because the exam like questions, they always help you to understand the exam psyche, the nature of the questions, what the examiners to expect, they usually expect from you, what is the level of knowledge you need to have for your exam. And yes, it also helps to build your reflexes. After completing a subject, solve its subject-wise mock exam on the website to identify your weak areas, and you also get evaluated by the mentor for each subject to build a strong foundation. Okay, so this is for those who are with us with our premium course. We have started from anatomy. We are going to start from anatomy. We will provide the mini schedule for each day, and then along with those topics, we will practice the SPAs in the evening. So this is the schedule for those. Okay, so the time management strategies, weekly planning tips. What you can do, you can allocate the daily slots like 2 to 4 hours. For this last 2.5 months roughly, what would I suggest? Please try to study for 6 hours every day. if you are already preparing for the exams, then 4 hours are sufficient. But if you are just a beginner, you just start your exam preparation, then please try to manage 6 hours every day. And what you can do to avoid the burnouts, you can just plan your daily slots. For example, you study for 2 hours in the morning, 2 hours in the evening, or in the night time. Break into modules, not books. For instance, if you're starting from anatomy, try to cover the anatomy in every possible way. For instance, if you it's all up to you. If you are following any textbook, try to study from there, build your concepts, highlight the important points, then alongside practice the SBAs of each module. No matter what book or what content you are utilizing, but please keep that in the modular form. Use timers, which is a Pomodoro method, 25-minute study, 5-minute break. Keep 1 day week for revision or rest. So what you can do, if you are studying 6 times a week, 6 days a week, then you might take Sunday off. Or if you are very enthusiastic or you have a limited time, you cannot manage 6 hours per day, then you can use that Sunday for your revision. That whatever you have covered in this particular week, you can revise that on Sunday. This will have to help to retain the memory. Then try to create your daily balance, study 60%, SBA practice 30%, and notes review 10%. This is classically for those who are already preparing for the exam. So how you are going to divide? You need to have a little percentage for the quick revision. If you have already highlighted the high yield points and you have made your own notes, or you have any notes for you, then start from revising those notes. Just quickly recap the high yield points and start practicing SPAs. Again, you can to avoid notes. You can study for 25 minutes and 5 minutes break, then 25 minutes study and 5-minute break. Okay, so here's a update for our new course, which we are going to begin in the very next month, which is the MRCOG-1 Premium Power Hour course, which is a fast-track course, which is classically for those who just started the exam preparation, and also for those who have already preparing for the exam and they want to solidify their all the studies they have done so far. So what we are going to classically, we are focusing in this course, we are focusing on the recalls, exam-like questions. We are focusing on the high yield points and the topics which are way more relevant and important for the exam. So the idea or the context of this course is to just quickly prepare for the exam. It is highly focused, highly strategic, and highly organized. What is included in this course? There are live sessions for all modules, which are not the modules, the live sessions, the lectures which are in the Power Hour course. They are not based on the theory, rather they are based on the recalls, and we are focusing on the recalls. We will discuss on the daily live sessions. We discuss the recalls and we discuss the explanation and the high yield points and the core concepts which are needed for the exam. In this course, we would also provide with a mini schedule, exam-like practice questions from year 2019 to 2025. Intensive subject discussions via Telegram, latest subject-wise question pool, solve recalls, free 15 days recall workshop, which is classically the workshop which we held for 15 days. And on the daily basis, we just discuss the recalls of the past few years. Then there is a special statistics session, subject-wise mock test, and 3 full-length mock exams. So these are the exclusives of the Power Hour course. And the course is starting from the 18th October. There is free help with exam booking also included. So before we close today's session, I would like to share the feedbacks of our previous students who have successfully achieved their journey. Richa, I would suggest you to practice from past MRCOG. It has 2 volumes and both are very good. The explanation is very to the point, and that would also help to build your basics for this exam. So these are the recalls. These are the pictures of the feedback from our previous students, and you can see how they are happy and what percentage they have achieved in this exam. Mostly our students, they scored more than 80% in the exam, and all of these students passed the exam in the first attempt. So here's some more feedback, more happy faces. Okay, for technical support or course registration, you can contact any of these addresses. You might contact on WhatsApp, on Facebook, or you can contact via email. Now, passing percentage varies each year, but you should be at least consider more than 65%. Sometimes it ranges from 68% to 74%. Sometimes it is around 70% to 75-6%. So it depends on the performance of the candidates on the exam day. But the average is 68 to 70%. Before we finish, does anyone have any questions or anything that would like me to repeat? Great. Thank you so much for your time and active participation. I wish you all the very best for your exam and your careers ahead. Take care and see you next time.